Hi, everyone. Yes, it's Friday, so that means it's time for our weekly COVID in Cobb update with Dr. Janet Memark. She's the head of Cobb and Douglas Public Health. And if you look at the numbers, if you look at the graphs, if you see the stats, things are happening in Cobb and Georgia when it comes to COVID. So, Dr. Memark, what about it?
You're going in the right direction. So we wanted to talk about that a little bit today. We do have over 15,000 cases. Unfortunately, we have 355 deaths. And so remember, that is probably the last metric that will be showing after we get our infections and surges and things like that. Dr. Redfield from the CDC did think that next week is when we're going to see the decline of the deaths, but we did have a spike of deaths in the month of July, and in August it has been on a higher trajectory, but we do hope that it'll start going down. But one of the things I wanted to make sure that we all are looking at is that 2-week case rate. That's an important rate for our county because it lets you know not what's happening cumulatively over time, but what's happening in the last few weeks. And so what we've been seeing is that we were at one point over 400 cases per 100,000, and yesterday or last night we're down to 318. And so we are heading in the right direction, but it is still high, and everybody needs to understand that. Anything over 100 cases per 100,000 is high. And so 300, the best thing about this is everything is heading in the right direction. So our positive testing percentages have come down, and they hover in the 6% range, around that range. And so that's under 10, and so that's very important. So transmission is a little bit lower right now, and we're coming down on that 2-week rate. And so why that's really important is that that's a very fragile number to be looking at. And so because we're doing really well, we have to continue what we're doing. It does not take much to have a considerable outbreak and then have all those numbers go in the wrong direction. So we got to continue making sure that we're distancing, wearing our mask, and please, the holidays are coming, to avoid large crowds. That's so very important because a lot of our outbreaks seem to happen in crowds.
Yeah, Dr. Memark is really concerned that even though the numbers are looking better, that people stay safe, they keep doing those 3 W's, that they keep up the mitigation, especially given the fact we're heading into the fall season.
That's what I'm very nervous about, is that, as we go into the winter season where it's easier for the viruses to transmit, that we're going to become complacent. And I know this has been a long, arduous time. You can still go and do things, but you got to do all those things that is going to slow down that virus. So we just can't be letting up right now. We got to keep, double down and keep going.
And one matter of continuing concern has to be with how the hospitals are doing, how many beds they have, how much capacity they have to deal with this sort of thing. And even though the numbers on cases are improving, the hospitalization rate's a bit of a lagging stat.
Hospitals, they were showing us a little glimmer of hope, but it doesn't take much for them also to get very, very busy. So we remained having critically short critical care beds. Inpatient beds are slightly better, but there's not a lot of room there as well. But like I said previously, they're not all COVID patients, but they continue to have a high number that are there that are being evaluated.
And if you've been on social media, you see a lot of people trying to compare seasonal flu or flu outbreaks with COVID-19, and really there is no comparison between the two. However, there is concern this year that the flu combined with COVID will make a bad situation even worse.
I got to tell you, we were very nervous about the season that's coming up, and that's flu season. So I pulled up just some numbers so that everybody can know, in 2018-19, we had over 16 million cases of flu just in that short period. And so, and that was an estimate from the CDC. Almost 500,000 people were hospitalized at that time, and we had 34,000 deaths. And that was the last flu season. And before that, we had, in 2017 to 18, we had 61,000 deaths with 810,000 hospitalizations. This is of concern because our hospitals are extremely busy during flu season. And so we need to, the best case scenario is that our social distancing and mask mitigation that we're doing now is going to help for flu season, and that's what we're hoping. But we need to also do more than that to help out. If we have a double whammy of flu and COVID-19, we're going to be in a very, very critical situation. So what can we do? Cobb and Douglas Public Health as an agency, we're gearing up to be offering flu vaccines. So I urge you, everybody, as soon as you can get a flu vaccine, get it. Because you know, we all know it's not 100% effective, but we also know that it goes a whole long way to prevent people from dying from the flu, and that is so very important right now. And if we can at least cut down a portion of cases of the flu, that will help us in battling COVID-19 as well. So please look out. We're actually working on doing some drive-through stuff and trying to get people vaccinated as much as we can.
Drive-through flu vaccinations would be something to see, especially down at Jim R. Miller Park. One thing about testing, though, in Cobb County at least, there is more of it, there's longer hours, and there's a better opportunity to get tested faster.
We have a lot of testing going on right now, and so I want to make sure everybody knows to visit our website. You can get a test right now, same day or next day at least, and we're offering at least 10,000 tests a week throughout the district. We have a new site near KSU in the BrandSmart parking lot, and so you can get tested there. And the great thing, I just want to make sure everybody knows, these are the self-nasal swabs that are happening at some of these locations where you do it yourself. You don't have to go all the way back and tickle your brain. So it's a much easier test. And the great news right now, we are getting test results sometimes as fast as the next day. We're getting that result back, but it's like average 2 to 3 days. So you will get that test result back very quickly. So please, if you are getting exposed, please get tested.
And one of the things that keeps Dr. Memark up at night is just the time of year and what we're going through, especially on our college campuses where the kids are back.
We have an influx of students that are coming in, and they're mostly the college students that are coming back right now. We are a little concerned because you've seen what's happened nationwide with the schools on campus are doing a phenomenal job of putting all of these preventive measures in place, but when they go out of the school, that's a little bit more of a challenge. And so we are keeping a really close eye on that, but we continue to be concerned that we're going to have a lot of young people that will be out and about and maybe not as strict about their mitigation efforts, wearing the mask and kind of staying 6 feet away from each other and avoiding large crowds. So we're closely monitoring that, but we definitely have some concerns about people being out and about.
So again, she wants to remind everybody on college campuses and off college campuses to keep up the 3 W's. Wash your hands, wear your mask, watch your distance, and especially watch the crowds.
So we want to make sure that we do our 3 W's. So wear your mask, please. Wash your hands. Watch your distance, at least 6 feet. But we want to add that last thing, which is please avoid large crowds. And when you're going on your vacations coming up, look at the areas that you're in and whether you're going to an area that has high cases, and be very vigilant about what you do.
And here's a factoid I found interesting. We've seen a lot about vaccines being prepared for COVID-19 and the fact we may be getting closer to that. Well, here in Cobb County, they're not waiting on a vaccine to be rolled out. They are already preparing to roll it out here.
So I wanted to let you know that the COVID-19 vaccine is on schedule right now. It is anticipated for the beginning of the year sometime. And I wanted to let you know that the state is actually preparing to have the vaccine distributed, and Cobb and Douglas Public Health will have a big role in that. And so right now we are gearing up to working on the procedures and protocols to do vaccine distribution. And I want to make sure everybody knew that and just keep looking out with us as we have more progress in the area. But we are preparing to distribute the COVID-19 vaccination.
All right, so the theme of the show, things are looking better. We're not there yet, so keep it up.
The fact that our numbers are coming down right now is a direct effect of what we're doing. And so because we have been doing a good job of doing our prevention measures, that's why we're seeing numbers come down. So please do not give that up because it can turn around very quickly. Let's keep going in the right direction. Thank you.